welcome back to my channel dedicated to helping you advocate for your own health one topic at a time. Yeah, so just out of the shower, excuse how I look here. I had a few people message me, thank you, asking me how we're doing today. This is the 72-hour check-in since I started documenting what's going on for us since we both got COVID on our trip. So it's actually later today. Normally I do this first thing in the morning here, and most of my viewers are back in the States. I'm 7 hours ahead here. So normally I'm doing this when it's morning time here, and then I just upload it and have it go online later in the day. But I didn't have an opportunity to do that today, so it's actually quite late in the day. But I'm going to talk about really how it was first thing in the morning so that we're still at the 24-hour intervals. So 72 hours, in reality, the more I'm thinking about it, it's probably like 24 hours more because like most people, once I tested positive, like most people, you look back and you go, oh, actually the day before I felt this and I felt that and I had no idea like that's probably part of this. That was the beginning, the first signs of COVID. So usually you count day 0 as the onset of symptoms or the first day you test positive if you didn't have symptoms. So for me, day 0 would have really been on Monday, whereas I tested positive on Tuesday. And that would make Tuesday day 1, Wednesday day 2, Thursday day 3, and today is day 4. So I am 24 hours into the Paxlovid. I started Paxlovid yesterday. So when I woke up this morning, I had had 2 doses yesterday morning and yesterday evening. Paxlovid is twice a day. It's 3 pills each time you take. That 1 dose is 3 pills. So 3 pills twice a day. There is a different dosing regimen for people with renal problems, but I don't fall into that category. So when I woke up this morning, I realized I had slept like without coughing all night, just like my husband had the night before. He started Paxlovid a day ahead of me. I'm really glad I started it. Sorry, I've got to rest my hand here and try to turn the phone a little bit. I'm trying to give you this view. It's like sunset, getting near sunset on the Mediterranean, but it's kind of cloudy at this point today. So I slept really well. There's really no more respiratory symptoms. Like sometimes during the day I had the slightest stuffy nose, but honestly, just like a lot of people, I have a stuffy nose every now and then anyway when I'm not sick. Sometimes it's an allergy to something or something I'm reacting to, or it's, whatever, dust, pollen. I happen to know what it is here, but it was just not bothersome at all, and it was very intermittent. Some people tell me, yeah, you hear my sometimes clearing my throat, but it's not so dry and tight. I really haven't coughed. I still do have the GI stuff, but it's actually not as bad, and I think it's a good sign that it doesn't seem to be like that post-infectious IBS type stuff. Some people do get that with COVID, just like they get it with GI infections. I've had that in the past, and it's awful. But the nature of that is it's very unpredictable, and you have a lot of pain, and one moment you're just fine, and then you like have to run to a bathroom or something. It's not like that. It's just I have diarrhea when I have to go, and it's just very different. It's not anything like when I had post-infectious IBS, so I'm hoping and praying it stays that way. As far as how we're both handling the Paxlovid, fine. Now, my husband started a day ahead of me, and he told me he did get a little of that nasty taste. And he told me when he did it, and I remember it was just kind of intermittent. It was maybe an hour after he took the med, and it only lasted a short while. I did use the tip that somebody gave me about the cinnamon gum. He thought maybe it helped, but it went away. It was very intermittent. Unfortunately for me, so I had a very intermittent after my first dose. I just had one bout of like a bad taste in my mouth. But my second dose, which was taken closer to bedtime, oh my God. Okay, so I had this like yucky, nasty, it was almost like morning mouth. I wouldn't call it metallic. Actually, metallic would have been a lot worse. So it's not as bad as I had heard or expected. But I did have a nasty taste in my mouth most of the night. At one point I got up and like gargled with some mouthwash. But I thought, oh my God, that's it for me. It's like, now it's here for like 6 hours. Maybe it's part of it is like how much you're focusing on it, because I noticed that during the day, it was more intermittent than that. Sometimes we both had it, sometimes we didn't. I wonder if at night, you only hear the dripping of the tap because there's nothing else to listen to. I don't know. It does seem to me it's a little bit of both. Maybe it's that you don't have anything else you're focusing on, but also I think it is intermittent. I have noticed that maybe the cinnamon gum does help a bit, and I was really happy that I actually had a whole pack of pure cinnamon gum, which we both love, but I had not opened it when we were here, so I had this full pack, and so now we have the full pack. Like, it should last us more than the 5 days, so that's wonderful. I did also notice that it's kind of changing my sense of taste a little bit, like while I'm on the Paxlovid. And no, I don't think it's the COVID because it started like after the Paxlovid. It's kind of in a pleasant way. It's not unpleasant, but things I do taste, like when I taste that cinnamon gum, it tastes a little bit different than it normally does. It's like more vibrant. I don't know what that is. Maybe it's just the juxtaposition against that nasty, what they call a metallic taste from the side effect of the Paxlovid. I don't know. I feel, on the one hand, a little disappointed about our trip because, like, half of it, was a 2 week trip. So we got sick after a week. So half of it's kind of, we're off our mission and we're just kind of sitting still. On the other hand, I'm really grateful in a way about the way this worked out because, first of all, I think there's something about being out of the environment where I had kind of habituated this, 3 years of risk aversion and anxiety and fear and all these concerns and how to do this. And, it just happened. And then I had no more choice about it. And here I was in this beautiful place that I don't associate all that with. Like, the only association here is like vacation and sunshine and, newness and quiet. And, if I had to be sick, like, honestly, if the one way to do it is to, be able to sit out by the Mediterranean. That's kind of what we did the last few days, just sat out by the pool or sat out by the Mediterranean Sea and enjoyed the breeze. Fortunately, we weren't all that sick. We were minimally symptomatic at all, most days not at all. And just, relaxed and enjoyed the sunshine and alternated between sun and shade. And I'm going to do a whole other video after I get back, I guess, because I haven't put it all into words yet about just how much this has been a paradigm shift for me. I know a lot of you have messaged me. I know a lot of people who have followed my channel for these last few years, like me, were extremely risk averse, and we all found ourselves being more and more the minority. So I've shifted from that, and that was my own conscious decision. Now, I'm not judging anybody, and I totally hear where you're coming from if you're still, if you're not doing that, or maybe you never will. But I will say that for me, I think this is the right decision. And I think I've moved to a different level at this point, and I'll be having a lot of things to figure out going forward. But I'm very grateful about the way it worked out. I do think having had that boost, I know a lot of people had the boost and then they got sick 6 or 8 weeks later and were very, very sick. So I don't know, but I do think that didn't hurt that I had the boost so close to when I contracted COVID. But for whatever reason, like however it is so far, and I just hope and pray that it stays this way. It's much better than I would have thought, and I'm very, very, very grateful for that. So again, thank you guys all for your well wishes. I so appreciate it. I'm going to keep you posted on how we do continued. I was going to say my appetite increased a bit. So I still got this GI thing, and I'm a little afraid to like eat too much or put too much in my tummy and get it upset. But I do have like a regular appetite. I'll eat 1 or 2 small meals during the day now, and that's totally different than a couple of days ago. So taking that Paxlovid, even though it was mild already, the course of our acute infection anyway for both of us is really mild, but that Paxlovid really it really turned the corner. That's a game changer, and my experience with it is I highly recommend it. I'm glad I did it. So I've just really got to think about how what I'm going to be doing like going forward and how to kind of organize the content of my channel to be able to still speak to all my viewers, because I think a lot of my viewers and a few people who have reached out to me have told me that they're kind of at this point, where I've been, where they're trying to figure out like how to find a new normal or how to get back to normal, and they've just been so accustomed to the mitigation, just like I've been, that they just don't know what to do first or how to do it. And that's one of the reasons I was cataloging my experience. I'm not telling anybody else what to do, and some people told me I'm being crazy and reckless and whatever, but I just thought that whatever happens to me, good, bad, or ugly, people could learn from it. And I'm a population sample of one. I'm not a study, but I think that it can help people, and the more people are willing to share information, the more it might help other people. I'm sorry, I'm kind of shaking the phone here. Let me know if anybody gets motion sick after they're done watching my videos while I'm on vacation. So anyway, tomorrow will technically be day 5. So 0, 1, 2, 3, 4, 5. It's like really it's the beginning of the 6th day. So when you've completed 5 days since symptom onset, The new recommendation, actually, that's going to be the case in Israel, I guess, beginning Monday, so in just a few days, is that people no longer have to have any COVID mitigation, even when they are acutely ill, when they test positive. They no longer have to mask, isolate, or anything else. Wowza! And of course, the CDC guidelines, we already know that after 5 days, if you're not symptomatic, you haven't been febrile. I haven't had a fever this whole time. I'm certainly not symptomatic. That you can go about your business. You're supposed to mask when you're inside for, a total of 10 days. I will certainly do that. I don't want to get anybody hurt. I'm not really going to be doing anything inside that I can think of. No, coming up. No, I'm not. I just don't feel comfortable going inside, like since I know, that I'm positive. So the question came up, will I retest? I don't know. I mean, probably, but I don't know which day I'm going to retest. So I'm not 100% sure I'm going to retest, but I guess, well, I will. I'm just not sure which day I'm going to retest. So, and then people also ask me about the airplane. Yes, I'm going to wear an N95 on the airplane. I'll be way through day 7 at that point, so there's no issue with that. But yes, I will. And they say mask, by the way, but I will wear an N95 on the airplane. I don't want to get anybody hurt. I don't think the airplane is really high risk. I think the airport maybe, but the airplane, I traveled over here. I mean, lots of people I know traveled during COVID and don't get it because the filtration on the airplane is so good. And I have my Synovia air filter, that tiny little HEPA filter that we travel with. So I will check in probably tomorrow again, so like another 24-hour check-in. Although today I feel like I don't have a lot of news, which I guess is good. Other than that, we are both even better than we were before and pretty much back to normal. If I didn't have some of that GI stuff, even though occasionally I have a little stuffiness in my nose, which, like I said, I do anyway, I wouldn't. I'd be what you'd call asymptomatic, and I'd be shocked if somebody told me I was positive. So, I mean, I guess it's possible I'd test negative if I tested right now, but I don't want to waste a test. That's the other thing. I've got a finite supply of tests here while I'm traveling, so I've got to be careful about how I use them. So let me know if you guys have any other questions. I really appreciate all the interaction, and people have been so encouraging. I was really scared. I purposely asked people to be mindful if they want to, write comments. Like, there's no reason to write something that's just going to be particularly scary, because I decided to take this leap, and now I'm in this situation. Fortunately, it is working out well by all measurable standards right now. You don't need to keep messaging me about, oh, but I might get long COVID. Oh yeah, I was going to say, it seems to me that the calculus on long COVID is even kind of changing. I don't think we know everything yet, but it doesn't seem really as likely in vaxxed and boosted people with Omicron breakthrough. The studies, even with the VA study that was done, and I spoke in my video yesterday about all the reasons that I don't even think that study is really generalizable to the population at large at this point now, but that study was started before Omicron was the major. Now it's really the Omicron sublineage is are the only variants circulating around. So I don't personally. Again, I don't want to go by what I personally know, but I don't personally know anybody who had like long COVID that didn't ultimately resolve, who got it in the last 6 months or 8 months or so. That doesn't mean that there aren't people out there. There are, and I know that, and I don't want to make light of it. But there's far more long COVID amongst people who were unvaccinated and got Delta and ended up in. I personally know somebody who ended up in a hospital and for months on a ventilator for weeks, and then had to go to rehab and learn how to walk, and still uses oxygen over a year later. So that's long COVID. So yeah, I'm trying to be mindful of it without really worrying about it. I've had long shingles. I've talked to people about that, and not only like pain at the skin, but shingles. I had some internal shingles these years ago, and it can affect your internal organs, and even that ultimately resolved, and that was devastating. So any virus, can have long effects, and the body can heal. And I'm going to be cautiously optimistic, not stupid, but I've decided it's time for me to find this new normal. And for those of you who aren't ready, and maybe my journey is still helpful to hear and to listen to for if you're ready later, and I'll still be here to talk with you. I already have in the last few days just interacted with some of those people who reached out to me, and that's all good. Okay, so yeah, let me just give you a nice view again to the extent that I can. I don't know if you can see. It's hard to see the sea because the clouds are kind of blending in with it, but that's the Mediterranean Sea behind me. So I'm just going to say good evening to you guys, and thanks again. I'm just so looking forward to some more of our interaction in the content. I really enjoy it. And until next time, be well. Bye-bye. Yeah.